Normal labor procedure. Part 1. Introduction. Objective of this video. After finish this lesson, students are able to first, describe the method of having a normal vaginal delivery correctly. Second, demonstrate the method of having a normal vaginal delivery correctly. Normal delivery or normal labor, euthanasia, must be one that has the following characteristics. First, the full term at the gestational age of 38 to 42 weeks. Second, giving birth in such a way that the baby's head is the leading part, or called vertex presentation, and the occiput is in front of the pelvic cavity or under the pubic bones, called occiput anterior. Third, giving birth by natural processes and not using obstetric to assist in delivery, such as forceps extraction, vacuum extraction, or cesarean section. Fourth, the duration is no longer than 24 hours. Fifth, no complication occurs during delivery. Part 2. Preparation of normal delivery. Partulent preparation. Positioning the delivery person in a dorsal recumbent or lithotomy position. Cleaning the genital organs of the delivery person scrub vulva with the following steps. First, adding the antiseptic solution into the scrubbing set. Second, wearing sterile gloves in the dominant hand. The other hand holds a medium-sized glove that contains cotton balls with the antiseptic solution. Third, placing a bedpan under the bottom of the partulent. Fourth, cleaning the genital area using a cotton ball moistened with the antiseptic solution in the following order. The first, cotton ball wipes the non-pubic area toward the abdomen. The second, cotton ball wipes the thigh on about 2/3 of the thigh. The third, cotton ball wipes the other thigh the same as the first thigh. The fourth, cotton ball wipes the labia minora from top side to down side until to the perineum. Then, turn the cotton ball over and wipe the same side of the labia majora from top side to down side. The fifth, cotton ball wipes the labia minora and labia majora on the other side. Do the same as the fourth one. The sixth, cotton ball wipes the vestibule from top side to down side until to the anus only once, and then discard the cotton ball. Preparation of the midwife. Wearing a hygiene cap, mask, goggles, apron, and boots. Washing both hands with a 7-step hand washing method. Walking through the door of the labor room using the back of body for pushing the door open. Wiping the hands with a clean sterile cloth. Picking up the gown at the collar part and wearing the gown carefully. Putting on 2 layers of sterile gloves. Preparation of equipment and tools. Laying the delivery codes. inserting the hands into the inside of said cover cloth and putting it under the buttock of maternity. Second, binding sock for the maternity from the near side foot to the far side. Third, placing the cover coat on the partulent abdomen by facing the folding leash to the partulent head side. Aligning the labor equipment and tools according to the order of use as follows. First, a perineum scissor or episiotomy scissor. Second, a piece of top gauze. Third, a newborn section birth. Fourth, an artery clamp with two rubber bands for fastening the umbilical cord. Fifth, an artery clamp. Sixth, an umbilical cord scissors. 7. A forceps. 8. A small cup containing 2 cotton balls with 0.9% sodium chloride or normal saline solution. Part 3. Delivery of the fetal head. Ascending the vulvar gapping. In case of vulvar gapping is found, this means the baby head is in an extension mechanism. The delivery to be done as the following steps. First, when head scene is found, the midwife helps improve the extension mechanism by using the index and middle fingers of both hands to within the labia minora and labia majora. Second, when the head crown or crowning is seen, the extension mechanism is complete. Cut the perineum if necessary. Crowning refers to the parietal prominence on both sides of the baby have passed through the vulva, so that the baby head will not return back into the vagina when the uterus relaxes. When the mother makes her push until the baby head comes out, the midwife uses 3 fingers, the thumb, index, and middle fingers of the left hand, to touch the leading part of the baby's head. When the head crown or crowning is visible, ask the mother to stop her push, open her mouth, take a long deep breath in and out. The midwife uses the left hand to scoop the baby head above the perineum edge. Lift the chin up. The right hand holds the top gauze to save perineum and let the baby raise its head slowly. Use the fingers of the left hand to place the baby head at the vertex. Right palm holds the top gauze over the perineum to collect the tissue and skin around the perineal area. Push the baby head up. Once the baby head has been born, the top gauze will not use it again. When the forehead has passed through the perineum, use the right hand to pull the perineum past through the baby face and chin, and then wet the baby head being transferred to the vulva, sucking the mucus and secretion, and then wiping each eye of the baby with a cotton ball moistened with a normal saline solution from the inner corner to the outer corner of the eyes. Shaking the baby umbilical. If the umbilical cord does not tightly wrap around the baby neck, gently pull the umbilical cord through the occiput, face, and shoulder of the baby, respectively. In case of umbilical cord tightly wraps around the baby neck, use 2 artery clamps to clip the umbilical cord and cut it. Part 4. Body delivery and umbilical cord cut. Delivery of anterior shoulder by holding the baby head between the 2 palms. Do not pull the hands under the baby chin. After that, pulling the baby head downward along the direction of the upper pelvic cavity until the armpit of the upper shoulder is visible, and then stop pulling the head. Delivery of posterior shoulder by holding the baby head between the palms and lifting the head about 45 degrees to the vertical until both arms have been delivered. Stop pulling the baby and then holding the baby straight out. Do not insert any fingers into the armpit or under the chin to pull the baby out, as this may lead to abduction paralysis. Placing the baby on its side, facing away from the mother vulva. Putting the umbilical cord over the baby and then killing the airway and wiping the baby. Umbilical cord. Cutting procedure. Before cutting the umbilical cord, delaying cord. Clamping should be performed for 30 to 60 seconds. The delay cord clamping helps increase the iron build-up in the newborn baby, modify the newborn blood circulation, reduce the rate of blood transfusion, reduce necrotizing enterocolitis, and intraventricular hemorrhage. The procedure of umbilical cord cut is as follows. Cut the umbilical cord between two artery clamps by cutting at about 0.5 to 1 cm away from the first artery clamp, holding the umbilical cord at the midwife hand. Use forceps to clamp the rubber bands one by one. Check the bleeding from the umbilical cord. Hold the baby to show the mother its gender and face. Then, pass it to a birth assistant. Part 5. Delivery of the placenta. Observe the following sign of placenta separation. Uterine sign. After placenta separation, the uterus changes its shape from round, flat, large, soft, discoid shape, and below the navel level to round, convex, small, solid, globular shape, and flows above the navel to the right. Cord sign. Once the placenta has completely separated, the blood flow from the placenta to the baby is cut off. No pulsing is on the umbilical cord. The cord will wither and move down about 8 to 10 cm. Vulva side. Bleeding from the vagina, indicating that the placenta is separating, with a blood volume of approximately 30 to 60 mm. This sign is only found in the Matthew Duncan method. Delivery of the placenta using the modified Clade maneuver is as follows. Roll the uterus to make it firm. Then push it to the middle. Ask the maternity to relax her abdominal muscle. Use a dominant hand. Push the top of the uterus down to the promontory of the sacrum. Once the placenta appears as the vulva, use the outer hand to support the placenta. When the edge of placenta is visible, use the hand that pushes the top of the uterus to lift the uterus up. Use the hand that holds the placenta to rotate it in the same direction. Part 6. Postpartum period care. First, bring the newborn to start breastfeeding within 30 minutes after birth. Second, Observe the postpartum hemorrhage. Third, observe the urinary excretion of the mother. Fourth, if complications are not found, move the mother and her baby to the postpartum ward.